IPL hair reduction basics. Prior to performing the IPL hair reduction procedure, ensure you have completed the following: consultation, signed consent form, photo documentation, skin Fitzpatrick assessment, and test patch. Assessing hazards. Assessing hazards is essential before firing any IPL or laser machine. A sign on the door, covering reflective surfaces, checking machinery and equipment, including cords, filters, and the integrity of the crystal. Pre-treatment setup. To correctly prepare your station for the IPL treatment, you will need to ensure you have the following: foaming cleanser and alcohol swab, disposable cloths and gloves, disposable razors, cold coupling gel, a yellow highlighter or white liner for marking a grid on the skin, aftercare such as SPF, and your safety protocols, including protective eyewear for the patient and the dermal therapist to avoid ocular hazard, ice packs, white adhesive sticker to cover tattoos, moles, or any raised lesions. IPL hair reduction. Prior to performing the hair removal test patch, you will need to identify the following to ensure the correct parameters are tested: your patient's skin Fitzpatrick, the area to be treated, follicle density and distribution, the type of hair, your target chromophore, the appropriate filter to ensure a thorough treatment, and the crystal size you wish to use. IPL machines have interchangeable filters to allow you to adapt your treatment by adjusting the wavelength, pulse train, and fluence. Test patch. Please note, manufacturers of IPL machinery will recommend a test patch prior to the treatment. Please always refer to manufacturer's guidelines and clinic policies and procedures. Test patching involves exposing a small amount of skin to 2 to 4 different settings to ascertain the most suitable parameters for each patient. The test patch must be performed on the proposed treatment site to minimize potential complications and enhance treatment results. It is the dermal therapist's responsibility to document the machine used, the filter, pulse train, and the parameters. The test patch should be reviewed within 1 to 14 days. If the test patch presents with erythema, hypopigmentation, swelling, or blistering, the parameters will need to be reviewed. If the patient presents with no adverse skin responses, commence the treatment on the tested settings. Please observe the dermal therapist assessing the skin and hair of the area to be tested. The patient in the demonstration has not had prior light-based hair reduction treatments. The dermal therapist has selected a 610 nanometer wavelength due to the suitability to the client's skin Fitzpatrick and to ensure the hair is effectively treated. To ensure comfort and safety of the treatment and to allow adequate cooling time, the dermal therapist has selected a triple pulse chain to follow for adequate heating and cooling. Patient preparation. To prepare the patient's skin, an alcohol wipe is used to remove moisturizer, sunscreen, or deodorant. It is common practice to ask the client to shave prior to the treatment, though in some cases areas are missed. A razor is used to shave the remaining hairs to avoid plume and burning the hair onto the patient's skin. Once the area is clear of hair, thoroughly check the skin for any raised or unusual pigmented lesions. It is very important to cover these lesions as pigment will be altered or removed from a malignant or pre-malignant lesion, making future changes in its color, border, and diameter unrecognizable to the patient or physician. Reviewing the test patch. Before selecting your parameters for the procedure, check your patient's skin where the test patch was performed. Communicate with your patient, asking if they experienced any discomfort, redness, swelling, microcrusting, or blistering where the test spots were performed. The IPL hair reduction procedure. Once you have determined it is suitable to proceed with the treatment, a yellow highlighter or white marker is used to create a grid system on the proposed site. This is necessary to not lose your position and to accurately cover all areas. The parameters selected for the treatment are based on the manufacturer's guidelines and, more importantly, the test patch, which is documented in the initial consultation notes. Cold coupling gel is applied to a small area of the treatment site. It should never be applied to a large area as it will simply warm to the body temperature and provide no cooling protection to the skin. Eye protection is required for both the patient and operator. To avoid ocular hazard, the protective eyewear must filter all relevant wavelengths. Ensure you check the optical density on the glasses to ensure suitable. Refer to 1.1 Dermal Science Theory to revise ocular hazards and optical density. When treating the leg, the handpiece is placed vertically so as to conform to the contours of the leg. You must also ensure complete contact with the skin rather than just using an edge of the crystal. This will help to minimize burning. Most IPL manufacturers will recommend approximately a 10% overlap with the handpiece. The purpose of the overlap is to create a more even distribution of the energy and not leave the patient with stripes of untreated hair. During the first section, frequently ask the patient about their comfort levels. Momentary pain during the pulse is expected and normal, though pain beyond the duration of the pulse can be indicative of burning. If this is the case, stop the treatment and immediately apply ice packs. Once a section has been completed, use a tongue depressor to remove the gel. New gel is then applied to the next section and so forth. The clinical endpoint should be visible perifollicular inflammation. This may vary from faint erythema within the follicle to obvious erythema and swelling. Remember to ask the patient how the treated areas are feeling. If moderate to severe erythema is present and or pain reported, you must apply ice packs immediately. This will greatly reduce further thermal damage to the skin. We will now demonstrate the IPL hair reduction procedure for the underarms. Aftercare post-IPL hair reduction. Post-treatment, you may wish to apply a cooling or soothing gel. If the treatment site is not covered by clothing, apply a generous layer of SPF. For aftercare advice, discuss the main points listed in the written aftercare instructions and provide a copy for the patient to take home. Cleaning and sterilizing after IPL hair reduction. Before you commence the cleaning of the IPL, make sure it is on standby mode or switched off. The recommended cleaning agent is alcohol. Following the cleaning checklist, ensure your equipment is sanitized thoroughly, including the touchscreen, handpiece, paying particular attention to the crystal, and any other part of the machine which may have been directly or indirectly in contact with the patient's skin. Finally, the used razor must be disposed in the appropriate sharps container.